This is a CIBMTR registry analysis, and in this study we compared the clinical outcome of patients with large B-cell lymphoma with relapsed disease who were in complete remission, and we looked at patients who either received autologous stem cell transplant or CAR T therapy and compared the outcomes. The background is that, of course, CAR T is the standard of care for relapse setting and as early as second line based on head-to-head randomized clinical trials. However, in practice, many patients have to wait, and some of them receive chemotherapy, and sometimes, not very common, but sometimes they achieve even a complete remission from the chemotherapy. The question is, should they pursue CAR T therapy, or now that they're confirmed to have a chemosensitive disease, should they receive autologous transplant? A number of smaller studies have shown that CAR T therapy, in fact, provides a durable, complete remission in many patients. So the intention was to compare the historical outcome of auto transplant versus CAR T in patients in CR. So in this study, we showed that patients who received autologous transplant, in fact, had a better progression-free survival and a lower rate of relapse. And that was confirmed when we limited the analysis in patients who had relapse within the first 12 months of finishing in first-line chemotherapy. So the results are informative for clinical practice. There are limitations to any retrospective analysis, so we used a database, a registry database, and we tried to adjust for confounding factors, but it's not going to be perfect. The other limitation is that more than half of the patients received T-cell in the CAR T cohort, which is probably a less effective CAR T compared to axi-cell and lyso-cell. Although in this cohort, the clinical outcomes were not statistically different between T-cell and axi-cell. So this study could be validating or informing clinical practice. In patients who have a relapsed disease after 12 months, the standard of care is high-dose chemotherapy and autologous stem cell transplant, and I think this study confirms that that should be the case still. There's no indication that CAR T therapy would overperform autologous transplant patients, autologous stem cell transplant in those patients. In patients with primary refractory disease, those who either don't respond to first-line chemotherapy or relapse within the first 12 months, we believe that CAR T therapy should be the goal of care. We should really try to improve access to CAR T and shorten the time between that decision and receiving CAR T therapy. Authors by no means recommend or indicate that those patients should be referred for autologous stem cell transplant. However, if there are patients who, for the reasons that I indicated, received chemotherapy and had a great response, and those patients can potentially be counseled about the possibility of receiving an autologous stem cell transplant, because that's another curative option, knowing the fact that CAR T could always be utilized in the later lines of therapy.